10 symptoms of kidney failure you probably do not know. Many people have chronic kidney disease but do not know it, because initial signs can be very difficult to see. It may take years for chronic kidney disease, CKD, to progress to kidney failure. Some people with chronic kidney disease live to the end of their lives without ever going to kidney failure. However, for many people at any stage of kidney disease, understanding of it is still optimal. Knowing the signs of kidney disease can help you get the best treatment possible. If you or someone you know has one or more of the following kidney symptoms, or if you are worried that you have a problem with your kidney, see your doctor. Blood and urine tests. Remember, many symptoms may not be caused by kidney disease. But the only way to know the cause of the symptoms you have is to see a doctor. 1. Changes when urinating. The kidneys produce urine, so when the kidneys fail, there may be changes to the urine as follows. You may have to wake up at night to urinate. The urine is bubbly or has many bubbles. You can urinate more often than normal, or have more urine than normal and urine is pale. The number of times you urinate less than usual, or the amount of urine is less than normal, the urine is dark. Your urine may have blood. You may feel stressed or have difficulty urinating. The following is a description of the patient. When you go to the toilet more, you cannot pee. And then you feel like the tension is down, it's really tight. Urine is the first thing I start to notice. Then I go to the toilet more often, and when I go to the toilet, I cannot go to the toilet. You think you need to urinate, but when it comes to the toilet, the result is only 2 or 3 drops. I have blood in my urine. The urine is very dark like grapes. And when I went to the hospital, there they thought I was lying about the color of the urine. 2. Edema. Broken kidneys do not remove excess fluid, so fluid builds up in your body causing swelling in your legs, ankles, feet, face and hands. Description of the patient. I remember that I had a lot of edema in my ankle. My ankles are so big that I cannot wear shoes anymore. With my sister, her hair starts to fall out, she's thin, but her face is really puffy, you know that's all the same until she finds out that she's sick. Going to work one morning, my ankles were swollen, really bulging, and I was very tired walking to the bus stop. And then I knew I had to see a doctor. 3. Tired. Healthy kidneys produce a hormone called erythropoietin, pronounced erythropoietin, which tells the body to produce red blood cells carrying oxygen. When kidneys fail, they produce less erythropoietin. So your body has fewer red blood cells that carry oxygen, so your muscles and minds get tired faster. This condition is called anemia. And this disease can be treated. Description of the patient. I suddenly felt exhausted and no longer a province. I slept a lot. I go home and go to bed immediately. It was as if you were always very tired. Get tired, and your health will run out even when you do not do anything. 4. Itching, rash and skin. The kidneys remove waste from the blood. When the kidneys fail, the accumulation of these wastes in your blood can cause severe itching. Patient description. It's not just a skin itch, it runs along the bone. I had to brush my skin with a brush. My back is bleeding from scratching too much. My skin was torn. I was very itchy and scratched a lot. 5. Metal taste in mouth, breath has ammonia smell. The accumulation of waste in the blood, called uremia, can make the food taste different and make the breath smell. You may also notice that you do not like to eat meat anymore, or you lose weight because you do not like to eat. Description of the patient. You will feel like a snot in your mouth, almost like you've been drinking iron. You do not have the same appetite as before. Before I started dialysis, I lost about 10 pounds of weight. 6. Nausea and vomiting. Heavy accumulation of blood waste, uremia, could also cause nausea and vomiting. Anorexia can lead to weight loss. Description of the patient. I have a lot of itch, and I vomit, vomiting everything out. I cannot keep any food or drink in my stomach. When I vomited, I could not eat, and then I had a hard time taking blood pressure medication. 7. Difficulty breathing. Your shortness of breath may be related to the kidneys in two ways. The first is the excess fluid in your body accumulates in the lungs. And secondly, anemia, a deficiency of oxygen-carrying red blood cells, can cause your body to be starved of oxygen and produce shortness of breath. Description of the patient. When I breathe, it will scare me. I think maybe I can fall or something will happen to me, so usually I find a place to sit for a while. I could not sleep at night, I could not breathe, it was like I drowned. And, I cannot go anywhere anymore. That's bad. You go upstairs to clean up the room, and then you breathe again, or when you work you become tired and you have to stop working. 8. Feeling chills. Anemia can make you feel cold all the time, even when you are in a warm room. Patient description. I noticed that sometimes, I was really cold, then I had shivers. Sometimes I get very cold. The weather may be hot, and I'm still cold. 9. Dizzy and distracted. Anemia associated with kidney failure means your brain is not getting enough oxygen. This can lead to memory problems, loss of concentration, dizziness, and dizziness. Patient description. I remember mentioning to my wife about my memory that I could not remember what I had done last week, or maybe 2 days ago. I really cannot concentrate, because I like to play crossword and read a lot, but cannot concentrate. I was always tired and dizzy. The situation was so bad, I was working, and suddenly I was dizzy. So I thought maybe my blood pressure or diabetes would get worse. That's what I thought. 10. Leg pain, ribs. Some people with kidney problems may have pain in the back or side due to kidney damage. Polycystic kidney disease, which can cause the follicles in the kidney to be filled with fluid and enlarged, and sometimes the liver, could also cause pain. Description of the patient. About 2 years ago, I always went to the toilet, and the lower part of my back was always painful, so I wondered why there was such a thing. The doctors had diagnosed it because of the problem. Kidney. And then you have to wake up in the night, when you have pain in your back and back, you cannot move. At night, I often have pain in the ribs. It's worse than hard work.